Hi, this is Wally Taylor. I'm a physician at Texas Integrative Wellness in Austin, Texas. And today I want to share with you for a few minutes as a strategy that I use in my practice of chronic complex illness to overcome the effects of chronic stress. In a previous video, I explained how limbic system stress, as a result of exposure to environmental toxins, is able to trigger many, if not most, of the symptoms of chronic complex illness, including chronic autoimmunity, chronic fatigue, chronic brain fog, anxiety, depression, insomnia, digestive disorders, many immune system deficiencies, and endocrine disorders that are seen in this group of diseases. I want to spend a little time in this video right now to explain some strategies that we use in our practice that seems to be very beneficial in helping people overcome this. So it was when we studied the work of some experts about limbic system impairment, especially Dr. Annie Hopper from Victoria, Canada, who developed a technique called the dynamic neural retraining system, and others, to learn about the role of limbic system impairment from stress. What we've found is that when people have persistent stress, which is usually due to the effect of these toxins on the limbic system itself, and what has actually been termed by some to be called limbic encephalitis, because it's actually been associated with obvious inflammation in the limbic system itself, to cause these very real symptoms in patients. We know that if we can get the brain out of the setting of fight or flight or fear, so-called sympathetic hypersensitivity or sympathetic overdrive, and to go more into the parasympathetic dominant rest, digest, regenerate, and repair setting, that this is associated with significant improvement in many of the chronic symptoms that are seen associated with this situation of chronic limbic system hyperactivity on the sympathetic side, the so-called fight, flight, fear, or freeze. So when I talk to my patients about this, I used to think before that all we really needed to do to allow the limbic system to completely recover, and in so doing, see all of these other associated signs and symptoms of chronic inflammation-based illness actually start to go away, was to actually just eliminate the body's exposure to these various environmental toxins. And I also like to make sure that I include in that so-called life toxins. These would be stressful events in life that, especially if they're sustained, seem to be incorporated with staying in this fight, flight, fear reaction. These would be everything from illnesses in a family member to financial calamities, injuries, all sorts of different life crisis situations, a difficult boss, difficult relationship, sometimes just being involved in a stressful situation like at school or work. But nowadays, I don't really feel the same as I did initially, that just elimination of these various sources that trigger this fight, flight, or fear is all you need to do to overcome it. And it turns out that in many cases, it actually requires a limbic system reset if you're going to get out of the situation. Some people will call this fight, flight, or fear a situation of high beta, because if you check the brain waves of people as they're in this setting of fight, flight, or fear, you see that the EEG shows a high frequency, low amplitude beta waves. And if you're able to convert this to a brain setting that's more associated with calming, or again, the parasympathetic rest, regenerate, and repair, you typically see that the brain waves slow into the slower alpha waves, or even slower yet, the theta waves, which are often associated with deep meditation and more of a Zen meditative brain setting. So what we've learned is that it's very important to try to eliminate the triggers that are pushing the body into fight or flight and fear, and actually to go out of your way to learn how to reset the brain out of fight, flight, or fear. So it turns out that we found that there's two very different but very effective ways that this can be done. And both of these sets of techniques are not mutually exclusive. By that I mean you can actually practice both of them simultaneously. But on the one hand, we talk about active limbic retraining, and then the other side of the coin is passive. So different forms of active limbic retraining are things that a person can actually learn. Of course, the first thing is just to understand that it's even happening in the first place, and that there is the possibility that resetting the brain out of fight or flight is beneficial. But some of the active ways that a person can do this are things that we've already known about. For example, prayer or meditation or saying self-affirmations or giving yourself more me time, pursuing hobbies, going for walks in the park, just playing with a pet, working a crossword puzzle. There's lots of different active ways, but some of the more definitive active ways would be formal meditation or yoga, or in the case of Annie Hopper, she has a program that needs to be practiced repetitively called the dynamic neural retraining system. You can learn more about that on her website, retrainingthebrain.com, and she has a very good book where she describes her theory about limbic system impairment called Wired for Healing. I can strongly recommend that. Also, I work with a lady here in Austin, Lindsay Mitchell, who has a program called VitalSide, VITAL-SIDE, where she actually works with patients to learn modalities and techniques to reset the limbic brain out of this high beta fight, flight, fear setting into more of an alpha or theta Zen-like setting. But that's also a good resource. You can go on her website, learn more about that. There's also a technique, a guy from England that has a program called amygdala retraining that you can read about as well. So there's a number of different modalities. There's also some formal clinics for feedback and neurofeedback that can do many of these same techniques. So in addition to the active ways that you can learn to reset the limbic system out of fight or flight, there's also a whole group of passive ways. So these would be things like modalities such as neurofeedback or neurobiofeedback. But some of the ones that we found effective in our practice here at Texas Integrative Wellness would be the use of infrared light waves on the limbic brain, as it seems to be able to induce a more calm and uninflamed state, not associated with fight or flight. We use pulse electromagnetic frequency, and there's any number of devices that are able to do this using actually a mat or a coil that can alternate positive and negative magnetic fields to the body and can induce a calming of the limbic system. We've also had some success with various forms of frequency-specific microcurrent, or so-called microcurrent cranial stimulation. One of the devices that we have used successfully here in our practice is the AlphaStim, which has actually been out for over 20 years and has been shown to be very effective, especially in cases of PTSD, such as military veterans returning from war sites associated with the kind of chronic fight or flight that's associated with that kind of chronic exposure to trauma and life crisis. So I want people to be aware that the limbic brain plays a real critical role in terms of the generation of many chronic symptoms of chronic complex illness, including, among others, it can induce significant mitochondrial dysfunction through what is called the mitochondrial cell danger response, and it can play a role in triggering mast cell activation disorder or mast cell activation syndrome, where there are actually neural controls over our immune system mast cells that results in the inappropriate release of harmful and toxic inflammatory mediators such as histamine, leukotrienes, and others. This often accounts for much of the multiple chemical sensitivity, much of the histamine intolerance, much of the chronic allergies that we see in many of our patients with chronic toxic illness. I will be talking in future videos a little bit more about limbic system and the way we've learned to try to help it recover in future videos. So if you like the video, please, I ask you to consider subscribing to my YouTube channel so that you can learn more about chronic complex illness. And please consider sharing the video with your social media, friends and family, so that we can get this information out for people. The last thing I want to say is I find that it's really helpful to have hope when it comes to chronic complex illness, because we have seen in many cases that we are able to reverse many of the, if not most of the symptoms by paying attention to these environmental toxins and the way the limbic system responds to their presence in the body, including the life toxins. But anyway, have a blessed day, and we'll see you soon.